So good afternoon, everybody. Thank you for being here today. I'm very grateful to be here to present a little about the services I offer to the community. I gave you a brochure. You can look at it later. You can also look at the website. If you ever need something related to natural medicine, that's what I do. My name is Claudia Chica. I'm a physical therapist practicing since 1987 and an Oriental medical practitioner practicing since 1989. So it's a little over 30 years of experience right now, clinical practice. And I'm very grateful that God gave me this path, natural medicine. I am very grateful for the Western medicine, for anything they can do to save our lives with surgeries or emergencies. But for any chronic condition, for longevity, for general health, for a happier life, this is our medicine. And I know Patty is going to talk more about the medicine of the prophet. It's very similar for us. In Oriental medicine and natural medicine, we're always resorting to nature. What can we use from what has been given to us to help us live stronger, healthier, happier lives in harmony with nature, not abusing nature or violating nature? So what I'm going to talk today about is the main scope of my practice, which is regenerative medicine. And it's mainly for regenerating any tissues in the body, from the skin to the internal organs or a joint or for any different problems we have. So I'm going to try to go quickly and show you some of the possibilities. So this is my logo, the fire from God, the water from earth, the green that signifies nature, the purple for me signifies our connection with God, spirit, and more blue and the earth, the soil that sustains us. Oop, a little fast. So I'm a physical therapist, doctor of Oriental medicine, and this is mainly about PRP with platelet-rich plasma, which is the red blood cells that are in our system that provide us with nutrition and oxygen, and how we use specific components of the blood to help us regenerate. And I'm going to show you different ways to do that. Regenerative medicine is for all our families, for our communities, for our children, and even our elderly. It's for all ages. And this is the plasma. I'm trying to see. Yes, this is a pointer. This is what we call platelet-rich plasma. It's an extraction of our own blood, and we remove the white blood cells, the red blood cells, corpuscles, and cofactors, and the only thing that is left is this yellow fluid. That is called our plasma. And that has the growth factors, the stem cells, and anything and everything that the body needs to regenerate all kinds of tissues. And ozone is another amazing modality. It's 3 molecules of oxygen together. The body uses oxygen in molecules of 2. So when we have an extra molecule, the body could really use it for its healing or nutrition, or to kill things that we don't want, like fungi, parasites, bacteria, viruses. We use it a lot for growths that we don't want to continue growing and vascularizing on their own, but we don't advertise that much because that is the world of Western medicine. But if anybody has a cyst or a ganglion or a mass or something that they're looking to have the body reabsorb, we can do it with ozone. It'll eat it in a very gentle way. Joint regeneration, that's especially for all of us, we're probably over our 40s, and sometimes our joints, our cartilage, our ligaments, our tendons start like bothering us This is specific for this. It will help us grow again, thicken the ligaments, the tendons, the muscle, the fascia, the fat that serves as a cushion inside our joints. When we use the platelet-rich plasma for our joints, we improve the stability of the joint, improve our function as well, but mainly our safety. Like when we have an unstable joint, we could buckle and we can fall. Or we may not be comfortable because it's very painful to put the weight on a foot. And if we're dancing, we may like skip the step because it's really painful and we don't know. Or we're going to lift something or hold onto something and we may not be able to because the arm is going to give. So before all those things happen, let's try to nourish our tissues so they can regenerate and heal instead of allowing them to get damaged even more. Platelet-rich plasma increases the tissue circulation, which brings the nutrients and also its oxygenation. And I'm doing an injection on a heel, on the lateral aspect of the ankle for stability. And this is another type of injection. It's called hyaluronic acid injections. We have hyaluronic acid in our bodies. It's a special sugar that feeds our tissues and attracts a lot of molecules of water. So it attracts moisture to itself and it makes everything plump. We can put it on the skin or any tissues in the body and in the joints to help lubricate them when they're painful joints. I'm so sorry, I'm trying to learn how to use this here. So lubricate the joints with hyaluronic acid. And when we diminish the pain and we bring a little cushion inside, then we can function better and hopefully diminish the pain. Dextrose plurotherapy is another type of injection. Again, dextrose is another sugar that we find in the body. We're working with everything the body already has inside. We're just augmenting it, bringing it to the specific area that is needed to help it heal and regenerate faster. When I put a solution of dextrose with water and vitamins, sterilized water, close to the attachment of the ligament to the periosteum of the bone, that attachment is going to thicken and grow. Like more little tentacles are going to go inside of the bone and grab that bone so that we can actually hold our joints in place, stabilize them. That happens also to the tendons and the muscles so that we can actually traction the other part of the joint and move it. That's how we have function and movement. When I put the dextrose injections, we enhance the healing and the production of collagen fibers. Everything in the body has collagen. We are like a sea of collagen. So anything we can do to nourish it, to increase it, is going to keep us more resilient, flexible, and hopefully without that much pain. In general, any injections that we do with vitamins or nutrients are going to improve the vitality, the endurance of our bodies, and tissue oxygenation and circulation. So those are called dextrose prolotherapy injections. Neural therapy injections are something that people use mainly for pain when there are interferences in the body from the communication in the brain and the autonomic nervous system with the rest of the body. So we put little blips on the skin of very light anesthetic and sterile water to change the threshold at which the neuron or the cell is going to react. Like if I have pain and this little push causes me to have pain, I'm going to need a huge push in order to have that same pain happen after I teach the body how to be more quiet and peaceful with this type of therapy. So for somebody with chronic pain or very strong pain, these are very gentle therapies that could help them diminish that reactivity to pain. This is the cycle of pain, the many different things that cause pain. We all have experienced it. Psychological problems increase our stress, and it causes tightness, and it causes muscle spasms, restrictions, weakness, and atrophy of the muscles. And in general, we decrease our function. So we can enter this from any place of the circle, and it will lead to the same creation of pain. And sometimes pain becomes chronic because if we're unstable, the body's going to try to stabilize us. If I have instability in my spine, for example, my body is going to create something called osteophytes. Osteophytes are little spurs. Like if this is a vertebra, it will fracture a little and it'll create little spikes so that they can grab the vertebra above so that we don't fall off. Because the spinal cord is in between the vertebra. If the vertebra slide forward or backwards or to the sides, we're going to hurt the spinal cord. So the body creates these spurs, the osteophytes, to keep the vertebra in place despite the pain that causes, or the muscle spasms to keep us in place, to keep us safe. So anything the body produces is looking for our longer benefit, long-lasting benefit. But we don't like it because it causes pain. Well, if we treat the reason why it started, we're going to be able to most probably lower that pain or get rid of it on a consistent basis, on a long-term basis. So we just need to find out why is the pain coming and looking at those reasons and address those reasons. We're not just injecting anesthetic blocks or doing epidurals to calm the pain because we're addressing the cause. We're really going to the source. This is the reason why you have pain. Let's work on that and let's see if the pain improves. Skin rejuvenation. Usually when we use platelet-rich plasma on our skin or any other nutraceuticals and vitamins, we can bring the skin from like lots of wrinkles to a lot less amount of wrinkles or smaller depth of the wrinkles. I'm gonna move over here. So the platelet-rich plasma skin injections are what we do. Sometimes people want it on their hands because the hands sometimes get wrinkles, or their neck or their face. Some people have scar tissue, some people have burns. So wherever we put that platelet-rich plasma, the skin is gonna grow and heal, and it's gonna look more youthful and revitalized, more flexible. So platelet-rich plasma helps to improve the tone, the texture, the complexion. It diminishes the wrinkles, the fine lines, and it repairs those brownish blotches that people have on the skin because of sun damage. When the sun burns us, or when people have laser treatments, sometimes they get deep burns inside, deep in the skin, and they start coming out, and you can see all the brownish spots and discoloration. And the platelet-rich plasma helps eat away those melasma and little marks and grow new tissue. So that helps a lot. It's not like Botox or Juvederm or anything like whatever they inject on you, you just stay like that, plump. No, it's a very gradual process. But since it's natural, it's slow. And the skin may grow 1 millimeter, but that's all we need to make it softer or to make that huge line a little more gentle and beautiful. So it's like enhancing our God-given beauty. We're just nourishing the skin and making it a little more vital. Let's go to the next one. And when the skin is starting to fall off, when it loses its tightness, it lifts it up. So that helps diminish the sagging. Prolozone injections are usually done also to increase the flexibility, the oxygenation, the nutrition of the skin, also to burn fat. But again, if somebody has like a ganglion, a cyst, or any growth that we don't want, when we inject the ozone will eat away whatever substances or growths we don't want. So it's really good for any problems like that. That could be blocking our nerves and tendons because a cyst may be growing. And anything in the body, when we need to increase our oxygen supply, or even in the brain, I inject little acupuncture points on the brain, and the oxygen goes right into the meninges, and it's absorbed through the blood. And that increases cognition and memory, and people become more alert and happier. And it's like your senses get a little flash. You can see brighter, you can hear a little better. It's like a jump start of all our senses and the body. Anytime we bring oxygen to our bodies, we're rejuvenating, we're healing. And again, this is all natural. It's oxygen. And vitamin and homeopathic injections, those are some of the homeopathics we use for the immune system. Echinacea, compositum forte, and gistol for viral infections, seal for joints and spinal problems, tromil is in homeopathic anti-inflammatory. They all come in injectables, so I can mix it with different vitamins and nutrients, and we place them wherever we need it in the body, in muscle spasms or discs that are herniated, or ligaments that have been torn. It repairs and helps many other conditions in the body. Like there are specific homeopathics for specific diseases and problems of different organs. That is the end of my presentation. If you would like to go to my website, you can see that I offer other services like acupuncture and oriental medicine. I do some nutritional recommendations. And I also do manual therapies like brain therapy, spinal therapy, lymphatic drainage, manual adjustment of the viscera, the nerves, and the blood vessels. It's called visceral, neural, and vascular manipulation. So sometimes we need a little tweak here or there. And it's a beautiful combination when we can access all these approaches that nature has given us to help our bodies heal. I'm not saying that I am healing anybody. The body is healing with the little support, with the little nutrients we give it. So that's the basis, the foundation of how I practice. And I'm gonna do a couple of certificate raffle at the end, and hopefully you'll win a little treatment or something. And please feel free to call me, text me if you need me. I'll be happy to discuss whatever conditions you may have, concerns. Yes.
When a person goes for these treatments, how long do they go?
Like how long does a treatment last?
Yes.
For example, an acupuncture treatment could last, if I do like a mini stress treatment, it's like 35 minutes, 45 minutes at the most. If I do like a treatment because of a specific condition, maybe an hour and 15 minutes.
And how many times they have to go?
It depends on how the symptoms improve. We're really working only to balance the body and improve the harmony and to create more vitality. So it's like we're giving resources to your body to heal yourself. So you may feel better in 2 or 3 treatments. You may need a couple more. Maybe we need some manual therapy to work on the brain or the kidneys or the liver, little fine tuning. Or ozone injections to give you more vitality, more oxygen so that you can get stronger.
What about have multiple sclerosis because of the migraine? Do you do that?
Yes.
Okay.
So the myelin sheath gets eaten, yes,
Yes.
and the nerves kind of like choke against each other and don't conduct really well, and the body gets weaker throughout time. What I have found is that acupuncture could really help. I have many patients who have multiple sclerosis, but as you treat the body and you revitalize it and strengthen it, the body is able to cope with the problem better, and you don't decline as fast. If you don't do anything, your body's going to get tired, and the decline is going to come probably sooner than later. When you do acupuncture or any of these manual therapies for the brain or the spine, specifically in your case, we might be able to stop it or slow down the progression. And many people get affected up to one point, and then their condition kind of like arrests, stops. And they don't have an exacerbation for 2 or 3 years. And then they only come back when they need a little more support. Thank you for the question. Anybody has any other questions?
The PRP, you can do the injection for the knee?
Yes. The platelet-rich plasma we can apply in many compartments of the body for multiple conditions. But most people know it because of its effect on the skin, tightening, lifting the skin, filling up the volume that we lose, and making the wrinkles smaller, or for orthopedic purposes. And that's one of my passions. I really love going after every little attachment of any little ligament, tendon, muscle in the joint to stabilize it. You probably heard about stem cells. That's the new trend. And what is interesting is that it's very expensive. So when something is giving you the opportunity to charge very high tickets, a lot of doctors could become more interested. But they don't realize, if I put the stem cell right where it hurts, that cell is going to be suffocated because we're not doing anything to decompress the joint. The approach that I do is working on all the ligaments, tendons, muscles above, below, on the sides and inside of the joint to offer an effect of decompression. When these ligaments, tendons, and everything grow, they're gonna lift up, tighten up, and it's like you open the joint. So that pressure in that little place that was hurting, it's gonna diminish. But by that time, you'll be more stable, more functional. So the pain is a side effect of the growing and regeneration of the tissues. That's why we do it. Sometimes people may have very advanced damage. It could help them. Like I have patients who needed replacements and they're able to put them off or postpone them many, many years. The problem with replacements is that there are no perfect artificial joints. You need to change them every 10 to 12 years. So if you have a hip replacement, knee replacement when you're 22 or 36 or 52, you know you're going to have 2 or 3 or 4 more replacements throughout the rest of your life. Every surgery is a risk. They're giving you anesthetic, they're putting your heart on a machine, your lungs on a machine. You're depending completely on something external. Anything can go wrong. Infections could happen. With these viruses, nobody wants to go to the hospitals these days. Hopefully, we'll stay away from them. But if we could delay the process or make it easier for us not to have those incredible amount of pain that the lack of strength on the ligaments and the tendons and the muscles produce when the joint collapses, and then we have bone on bone grinding each other. If we can prevent you from going to that extreme and gain you many years of more comfort, stability, and safety, you'll be much better. If you really need the surgery when you're 72 or 92 or something, maybe you can do it, but you'll have maybe only one because it's hard to do it repetitively. It's gonna bring our health down. And also, some people say like the more I wait, the more science advances. So we're waiting for like, when is that surgery that is less invasive and not as damaging? Yes.
What about a person already had the surgery? Then I guess after 10 years, and then they have pain. Do you still treat that?
Yes, that's a beautiful question. Thank you for asking that. When we have, let's say, osteoarthritis, let me see, how can I depict this? We're still within our time. I'm trying to move without breaking this. So let's think, we have the joint, really? And the joint has these amazing, beautiful ligaments, muscles, tendons supporting it in place. It's like an elevator with all those cables. They support that and it moves. So the joint will have an axis upon which it will move. Flexion, supposedly, like that. So if these ligaments, muscles, and tendons get weaker, the joint will collapse. The ligaments will be like, all like that. They're not like taut and tall and strong. They will be like, so the joint collapses. So when that happens, the grinding of the joint, the bone on bone, the pain is awful. And then we have replacements. When they do the replacements, sometimes they fracture the end of the bone. So they cut all this end of the bone, all this end of the bone, and then they put caps with the new joint. But nobody does anything to those ligaments, tendons, and muscles. They're opening, stretching everything. Imagine these are already lax, and you're putting a new joint, you're breaking everything, stretching it even more to put the new stuff in. These are going to be even weaker. So you have a new joint with muscles, ligaments, and tendons that hardly work. Nobody did anything to help them. So when we have the replacements, if you have platelet-rich plasma after that, you're going to work on the ligaments, tendons, and muscles and strengthen them. So your joint is going to work much better. And if you're having any symptoms, like if you need to replace it soon, it may postpone it another 5, 7, 8 years. If the joint doesn't bother you, they don't replace it, they don't change it. But if you're having problems, then they will think like, oh, it's time to change it. But if we can really push it away and maybe never have it done, even better. Now, there are people who really need it, like if there's a strong misalignment or somebody had a severe accident, yes, if that's the only way to get them back to function and be safe, please have it done. It's important that we do it. But again, we could feed those tissues after the surgery, and then we'll be even stronger. Any more questions? No? Thank you so much.